Hello, everybody, and welcome to our webinar today, our HIPAA Prime Exclusive. First off, I want to thank everybody for being a client and for joining us today, for taking time. We are recording and we will be sending this out to everybody after the fact. So if you missed the beginning, you can always go back and scroll through, but we're just going to get through some business here to get started, and then we're going to jump right in. The hope is we're going to end a little bit early today. I know we blocked off for an hour, but hopefully we can end a little bit earlier so we can get you guys back to your day. Because I know you love spending all your time doing HIPAA compliance, but we do want to be cognizant of time. So this has come up a lot. We're just trying to understand. Well, I guess we should get into some business things first here. So thank you again for attending. Any questions you have, go ahead and submit those in the chat box. I've got both Tessa and Jillian here with me today. So if you have any specific questions for them or anything that you want to ask as we go through this, please feel free to let us know. I apologize. I have a dog who just insists on being in my lap and will not leave me alone. So we're going to do this with say hi, Lily. So please, yes, submit any questions and we will answer as many as we can by the end of the webinar. So today we're going to discuss the risk assessment report, why it matters. We're going to provide guidance on how to effectively review, clarifying scope. This is a question that comes up a lot as we're going through items. And then we're going to explain the transition from the risk assessment to the policies and procedures creation. If there's enough questions or enough interest, maybe next month we can go over policies and procedure creation, what that looks like, how to go about that review, etc. So just let us know over the next, we do these on the off months. So just let us know so we can do that for our June webinar. It's hard to believe that we're almost into May. So here we're going to start with some essential concepts. So with the scope, the delegation, and then we're going to go into the policies and procedures. So the scope of the risk assessment. So we really want to look at just how PHI is flowing through your organization. Now, if you guys decide to expand that out, we do have some clients that have done that. That is fine. That is absolutely, a valid way to use this. We do use the NIST 800-171, which is usually for Department of Defense. We do reference the 800. The NIST 830, which is the also Department of Defense on a higher level. And then we do also go through with HIPAA compliance and then the NIST 866. So all these numbers. Those are all items that basically just say we are looking at what the National Institutes of Standards and Technology is. So you can take this broader if you'd like, but really what our focus is on is where does PHI exist within your organization, who has access to it, and how it's being used. So we're looking at, on a higher level, even we're looking at administratively what's happening, who's in charge, physically what happens with any paper or any devices that are there, and then technically we're looking at any electronic PHI. So our goal here is to identify associated risks specific to that PHI. Now, and I've said this a million times, and I'll probably say it 10 more times in this webinar. This is not right or wrong. This is not an exam. This is not we're here to grill you and to report any information that comes in. We are here to work with you to figure out where the vulnerabilities exist within your organization so that we can mitigate those. And we're going to do our best to do as much as we can. There will be items that you'll find will be cost prohibitive or will not be something that your organization can handle at this moment. And we'll discuss that a little bit later. But really what we're looking for is this is just a fact-finding mission. We want to make sure that we have eyes on what's going on, that you have eyes on what's going on, and that we're really making sure that we have a grasp on what's going on in the organization when it comes to protected health information. So in your risk assessment, you guys will see the delegations. This comes up occasionally. So the items that are delegated to us, to Total HIPAA, our team will resolve by creating policies and procedures and making sure that those fit within what you guys have given us in the risk assessment. I'm going to talk a little bit more about this later, but this is where the truth really helps us. So being as thorough in answering those questions that come in, and making sure if you need to make any comments, making sure that we have a thorough picture, because we don't do your business. We work with a lot of different kinds of businesses. We try to do our best to understand what's going on so that we can write a policy and procedure that is effective for your organization. So please make sure that you review those items and give us as much clarity as possible. So again, anything is delegated to us, we will resolve or create, and that includes those customized policies and procedures for your organization. Any items that are delegated to you are internal actions that you need to take care of. Now, that could be something as easy as designating a privacy and security officer, but it could be, any technical, physical limitations that you need to put in with your IT. That could be internal IT or external IT. Is just making sure that you guys have a grasp on that. Something to be clear about is we are a third party. We do not do implementation necessarily for you guys. We will make suggestions, but the analogy I use all the time is like the first Jurassic Park, and I should learn the character's name, but the guy who we know from Seinfeld who plays Newman, who says he's the greatest programmer in the world. And as soon as the power goes out, nobody's checked his code and all the locks unlock. We're that group that says, hey, you know what? When the power goes out, let's make sure that the locks stay locked and the dinosaurs stay where they're supposed to stay. We think of the same thing with PHI. If something happens, we want it default to a lockdown situation and make sure that things are protected as best as they can. So that's really what we need you and your IT group to make sure they're doing. Is we may flag a vulnerability, is then going back, making sure those things are locked down, and then coming back to check with us to make sure that that's sufficient. So that may require a few conversations. That might be something that happens in year 2. What we have in this risk assessment is really a snapshot for that moment in time that we looked at the systems and that you looked at the systems. So we want to make sure that as you guys are updating things, this also brings up another idea is, as you guys are updating systems, maybe operating systems could be changing into different EHRs or CRMs. Is as you upgrade those software in your system, make sure that you're reaching out to us and letting us know what's happening. If it's if it's a large enough change, we may go ahead and have you go in and take some of your risk assessment again. Because we want to make sure that you guys are aware of what's going on and any risks that you take on with taking on new software and new processes in general. So vulnerabilities and your policies and procedures. So your vulnerabilities are resolved via your customized policies and procedures for the most part. And I say that kind of open-ended. A lot of these things we're gonna say, hey, have you, for example, and something we harp on a lot is multi-factor authentication or MFA. We want to make sure that you guys have implemented that in every place that you possibly can. And determine that has been implemented as much as you can organization-wide, and then let us know what that looks like. So is that going to be through a Google app or a third-party authentication app? Is that going to be through a key where you actually plug a physical key in? Is that going to be done via text, or is it going to be done via email? Just FYI, you may see vulnerabilities with email authentication. We're not really big fans of that because we see things like, basically people taking and rerouting folks' email and being able to take the cookies and be able to take their MFA, and authenticate off that. So, and that's a little bit on the technical side, but I just want to make sure that you're aware that that's not your best option. Text is becoming less and less of a safe option because it's easy to mimic cell phones. So we really want to look at authentication apps or potentially in keys. And then even beyond that, going to pass keys, but that's a different discussion altogether. So really what we're looking for is we need to know how you're going to mitigate things that we bring up or things that we find and vulnerabilities that we find in your organization. And that's going to be part of creating those customized policies and procedures so that we're documenting properly, so that if an issue creeps up, that we do have a breach that happens, that we are properly armed and ready to go, and we can get in touch with the proper folks. So some of your key components here, you'll see within your risk assessment, you'll see a vulnerability for those items that look like vulnerabilities to us. You will see those as high, medium, and low. So that does not mean that those low items are any less important than the high items. Typically, the high items are critical items that we need to get mitigated very quickly, and also may have a lot of bang for the buck. I know that things like, again, going back and harping on MFA, that is something that we see as a critical item that is listed as a high item. We want that mitigated as quickly as possible. You may have some items that stay out there, and I think I'm going to talk more about that going on. Remember, again, this is not an exam. This is not right or wrong. This is just things that we see and our system sees as we go through this process. You will see specific law references. So depending on what kind of organization you are, for our insurance agents, you will see GLBA references also to the Graham-Leach-Bliley Act. For folks who are non-banking, non-financial institutions, you will not see GLBA information. You will only see the HIPAA law references. Those law references, if you want to geek out and go read the actual law, you'll see where we derive these questions from, and you can go back and look at that. So you will see a solution or an action item. Those are recommended actions to resolve what we have going on. So that's where we will say things like, if you don't have a way of tracking mobile devices, that maybe you get a mobile device management program. And then we give you, if you need specific recommendations, we can give some recommendations, but that's usually a conversation that's better to have with your IT folks and make sure that you're discussing that to make sure that it's set up properly. And then, as I stated earlier, we've got the severity rating. So we got the high, medium, low that's associated with each vulnerability. Typically, most of it's kind of weighted more towards the high side of things, but some of our things like logging tends to be on the lower side. Not that logging is any less important. It's just can be a little bit trickier and take longer to put something like that into place for your organization. So we want to be cognizant of that. All right. Okay. So how to review a report. So navigating the application and some key items as you go through this. So we want to make sure that as you go and you review things, and you'll see, making sure that we flag things, is making sure those items are correct. And if we ask you questions around it, please don't choose I don't know or say I don't know. It's not really an option. If you need help or specific help, please reach out to IT, or you can reach out to us. If you do reach out to us, just make sure you aggregate all your questions. So make sure you've gone through everything. Don't just get stuck on one question. And within that application, you can say, hey, I need some help here. But just make sure as you go through and do those reviews, especially on year 2, 3, 4, is make sure that everything on there is accurate. As systems change, we may need to open up additional items for you guys. And that's fine too, as systems change. So maybe you're adding passkeys as available for multi-factor, or you've retired servers altogether and you're going into cloud servers. So we need to know that so we can make modifications within that risk assessment that will then start to open up new questions for you. Oh, joy. And making sure that things are as accurate as possible. Don't be afraid to add comments. So please clarify, add comments. It's key for us to understand what's going on, why things were flagged, why they're there, why you may have an alternate means for coming to compliance, or an alternate way for authentication or something like that, so that we understand, so we can document. We'd love if everybody had everybody had the same way of doing things, but we know that you guys are unique organizations, every one of you, and we want to make sure that we have a clear understanding as we do that, and that the comment section will really help. One of the key items that we have within this risk assessment is we have the ability to get IT and activate a basically a profile for an IT that can be a consultant or it can be somebody who's internal for you guys. So please make sure you take advantage of that. Let Tessa and Jillian know if you need to add a consultant. You may or may not need them to go through the training. If they're an independent, they've signed a business associate agreement, they have their own HIPAA compliance plan, which we hope as they're helping you and that you guys have reviewed that, which is part of your risk assessment. FYI, you can add them in so that you can assign questions to them. That will make everybody's life a lot easier if you've got IT engaged, because as you guys know, many of you, I'm looking at the guest list here or attendee list here, who's been, you guys have been with us for a while, is that trying to do it by yourself, if you're not aware of what's going on in IT, is a Herculean task and quite possibly impossible, knowing the complexity of systems these days and what's going on. So take advantage of our system. Make sure you are putting your IT person in, whether that's internal or a vendor, so that you can then assign them questions and they can go ahead and take that on their own time and make sure that you don't have to necessarily be there to hold their hands. So,
and I'll pop in for a second, Jason,
yes,
and
please.
also say that on that reviewing for accuracy, we understand that we're going to be providing you a lot of information in the vulnerability, in the action item, and also in the analysis. The analysis is kind of our deep dive into why it's important, and the action item is kind of summary, a checkbox that you can check off if it says signed business associate agreement with so-and-so. Excuse me, we know that that's a lot of information you're getting thrown at when you're first taking the risk assessment. Excuse me, and then also reviewing the report. And so if answers change, please don't be embarrassed. Please don't hold back. Like we're saying, we need an honest feedback. And so if there was an answer that was a yes, that needs to be changed to a no, or an answer that was a no, that with more clarity of the risk analysis and kind of taking a step back and reviewing it again with fresh eyes needs to be changed. This is a great part of the process to do that. As Jason's going to get into in this slide, actually, is that this is kind of the foundational information that we're going to use to create your compliance plan. And so definitely using that commenting feature is a great way to let us know when things have changed and questions need to be updated. And then we can absolutely go in and update those questions. There may be additional questions that we'll need answered in the risk assessment, which I know can be quite annoying depending on certain things, but just know we're here with you for the process and we're trying to make it as easy as possible, just trying to gather all that information as once, so then it's kind of less work for you on the back end of getting policies and procedures that maybe don't exactly fit your needs. And then we kind of have to put the puzzle together as to where things went wrong.
Right. Thank you, Tessa. Yes. Yeah, the more information you can give us in the comment section, the more helpful that is for my team as we go through this. And making sure that from that side we know what's going on, and it also helps Tessa. She's delegating the tasks out to know who to send the tasks to and who needs to review what. So yes, when you see issues or you see questions from our team here at Total HIPAA, please make sure that you review those and that you give us some feedback as to what's going on there. Just because as we go through that, we may end up from year to year may have the same vulnerability that stays there. One of the hardest things to get with HIPAA right now is the 6 years of logs. That comes up, I would say, with 99% of our folks. And unfortunately, it's written in a way, and at a time that was written, logs were done in a physical manner, and you would have maybe, hundreds of logs a year, if not. Now we have millions, if not billions of logs, especially if you're a large corporation. That's a lot of data to keep and to manage. So we have to sit there and say, okay, what is the benefit? What's the cost? What are we doing here? And how do we mitigate this? And so what we need to be able to say is, if we get into a breach situation, is we looked at this, we determined that it was cost prohibitive for us to then have those logs, and then moving forward, we will review it every year to make sure that that's still our policy. And that's fine if that's the case, but we could spend tens of thousands of dollars to get the logs up to the 6-year logging, and what is that really going to get us in the end? And we're not really sure. We'd rather, find more cost-effective ways to use those dollars towards compliance. So I know that gets a little in the weeds, but that's just sort of explains why a vulnerability that exists on your risk assessment from year to year is not necessarily a bad thing. It's just a situation where we've accepted that risk. We know it's there. We've looked at it, but we also say, well, we really can't mitigate it at this point. Either it's something that we physically can't do, it's a cost prohibitive item, it's we don't have the technical capability for this, but we realize that this needs to be addressed and looked at, and possibly next year there'll be a better solution to the problem, and we'll be able to leverage other technologies to address some of those items. Like, okay, we have millions of logs, and now we're using AI to review those logs, and we have this program, and it's very cost effective, hypothetically. So these things we will look at from year to year and make sure that we have those, that we go through that. So yeah, as we go back and forth, and as part of the HIPAA Prime plan, as you guys know, you can submit comments back and forth, and we may go for 4 or 5 rounds of comments. At some point, if we get really deep into things, we may need to get on a call, discuss what's going on, so that we have a clear understanding of what's happening. But use that commenting feature and make sure that you're giving us that information. Once we all agree that we have gone through everything that we can, and that we all feel good about where we are, we will then finalize, and we'll give you that finalized report, which is, again, as I said earlier, that snapshot in time. That is your time for April 29th of 2026, where we were when we finalized, and so that we know, okay, this is where we were today. And then next year, when we get into this, we see how we move forward from there. And we maybe have knocked a couple of additional items off of the risk assessment. I know that we get some comments like, great, we're working on implementing this program. This could be, something like passkeys, or we're getting, we're implementing a new process for updating operating systems, those sorts of things. So we will check back next year, make sure, and if you guys get that done beforehand, then maybe that's something that we need to go ahead and put into place sooner rather than later. But typically, that's we'll go back and look at that at your annual review. Once we have verified everything, we begin creating those personalizing and customizing your policies and procedures. As you guys know, that's both privacy and security policies and procedures that you're required to have. That also includes your breach plan. So we want to make sure that we have eyes on anything as far as mitigation on that side, so that we can document that properly, because that is a requirement. Also, this is a great time, once we get those policies and procedures, is to go through, make sure you've reviewed all your business associates, and that you've looked at those, and especially those agreements that are a little bit out of date. We like our business associate agreements to be reviewed and updated every 3 years. Sooner if they're doing real technical items for you guys, but we think 3 years is a good limit to just go back and review. Now, when it comes to these larger groups, your Googles, your Microsofts, your, these large organizations, they are not going to give you a new business associate agreement, but it's a good idea to go ahead and download the new one, or download a new one every 3 years. And I know we've got processes, we've got blogs about that. And we also have it within our risk assessment where to grab those documents. So, and a simple Google search will allow you to grab those too. But it's just a good idea to go ahead, grab those, make sure that you have updated agreements. And then also with that, make sure you're getting updated agreements from smaller vendors that you have, because a lot of times people will sign those agreements, will not actually do what they're saying they're doing, and you give them a new agreement, they may question what it is and why they even signed it in the first place, which is always a eye-opening experience. But we want to make sure that we're with you guys, that we're going through and we're doing those annual reviews and we're looking at all those items. So That was a lot of information within a 25-minute span. I'm going to open the floor up to any additional questions that maybe people have, any specific questions they have. Be careful as we are in a shared environment, so please don't share any specifics about your organization, but please feel free to ask any questions about risk assessment, the process, or anything that goes with that.
So I think our first question is that I'm reviewing my risk assessment report. It's been finalized and I'm a little confused about when I should start mitigating vulnerabilities. Do I wait until I have my HIPAA compliance plan, or can I get started on mitigating some of those action items delegated to me while I'm waiting for my plan from Total HIPAA?
Absolutely get started right away. I think it's really important that we go ahead. We're moving forward on mitigation. And especially when you see those vulnerabilities, the best day to get started is today. So anything that's easy to take care of, anything that's easy to implement, let's go ahead and work on moving that forward. So, big things is if you're not using MFA, multi-factor authentication, make sure you've got that on everything. That includes your personal life because we share device. We have shared access a lot of times. We're doing things at work sometimes that are personally personal in nature. It's just a good habit to get into. That can save you a lot of headaches. And use applications. Again, as I said earlier, don't use email for MFA if possible. Better to use text. Even better is to use an application. The best is to use a key fob that you would plug into a USB port. Or something that would generate a code that would be a third-party device. So all right.
Yeah, and I think to add on that as well, I think that a lot of questions that our clients have is, as we mitigate things, how do we let Total HIPAA know? A great place is to always go back to that risk assessment report in our application. And as you resolve things, leave comments for us. If you're a longtime client with us, you know that unless there's a major update within the year from when we give you your HIPAA compliance plan to when we do that annual review of your risk assessment, there may be some downtime between us, and we might not get to update the risk assessment every single time that you make an update. For example, you've got a business associate agreement with someone or something like that. But if you leave those comments for us, we will make sure that when we open your risk assessment for your annual review, we will make all those changes ahead of time before you're seeing the risk assessment. And so using those comments is a great way of almost a tracking mechanism for not only for us, but for you as well, to see what action items you've addressed and kind of leaving a history of compliance. As I'm sure you know, Jason, I love to use the term that HIPAA is about the journey, not so much the destination. As he's alluded to, there's going to be vulnerabilities on your report even in year 4, year 5. And that's just the nature of being able to tackle all of these things and knowing that HIPAA is not your full-time job. And so we are here to be that HIPAA brain. And so if you can log in for 5 seconds and let us know that you got this business associate agreement signed on this date, that's going to alleviate some stress for you on that annual review.
Yeah. And I think that's something great to reiterate. It is about the journey. It is really about, and especially with the last Trump administration, when he was leaving office, he signed an executive order saying if you can show at least a year of HIPAA compliance and active work towards HIPAA compliance, that severely limits, if not alleviates, fines and corrective actions. So I really stress that you continue this process. This is why this is an annual process, but this is also because the landscape changes, and it changes constantly, as we're seeing. We're seeing with AI coming out, we're seeing with operating system updates, whether it's on your phone or your physical devices. So we just want to make sure that you guys are aware of what's happening as much as possible. And be that brain. And also with the substance use and disorder information, I know that a lot of folks got that, and it was a big push. Not a lot of clarity as to what that was from HHS, but knowing that we had to get it into place right away for everybody. So those kinds of updates are just part of that process, and we expect that there will be, it's like everything. We grow, we move, we continue to evolve as we learn more, and we're trying to do better today than what we did yesterday. That's really the goal of compliance and the goal of most things, actually. So, all right. So
And I
again,
think our next question is about delegations on the annual review. I think this person is saying that on their annual review, they received their report and there were still items that were delegated to Total HIPAA but we had given them that information. So they assumed that would be updated. And that kind of goes back to what Jason was saying, is that we cannot do the physical implementation for you. And so we can give you all the tools. We do give you everything delegated to us, but it is your responsibility during your annual review to change that answer of I do not have HIPAA policies and procedures from a no to a yes, because we cannot confirm that you have implemented it. And if it is sitting in your email from me, it's not the same as being implemented. And so we've burned ourselves before. And so we don't make the assumption that things have been implemented. We know that you have a lot going on, and it is possible that you have not gotten to doing that implementation yet. And so if there is confusion on the delegation, definitely reach out to me or leave a comment on your risk assessment report.
Yeah, that's a great point. If we've created those policies and procedures for you, what we're looking for is you to confirm that you've done that implementation. So, yeah.
Most of the time when you do change that answer, it will be a yes, no, yes, Total HIPAA created this for me. And so we give you an easy we try and set you up for success. You can change that answer easily.
Perfect. Thank you.
All right. Next question is, based on our experience, where do organizations tend to see the biggest changes after completing the risk assessment and implementing the policies and procedures? Does the impact tend to be more concentrated in areas like CRM usage, communication tools, device access management, vendor management, internal workflows, staff behavior, etc.? Or where would you say that impact tends to be the most concentrated?
I think the impact really is about staff behavior. I think there's a lot that happens in IT and a lot of things that we can do from a technical standpoint. But really what comes down to it, and the hardest part of this, and also the weakest link, is the employees. And I don't say that to create war with employees, but social engineering and making sure that people are doing things in a compliant manner is one of the hardest things and one of the hardest steps. I wish I had a magic wand that I could wave over everybody and they would do the right things. People make mistakes. People do things because this is the way they've always done it. Sometimes it's malicious in the way they do things. So I think there is a lot that we see as far as tweaks within a system. I mean, one of the things that we pride ourselves are here at Total HIPAA is really leveraging programs that are already in use. So making sure that that we're putting data into the CRM or the employee navigator or the EHR, much more than keeping it in an internal system where there's backups and network questions and firewalls that we need to manage, that, we say, hey, let's outsource this to a company who's, not only developing the software, but wouldn't, is going to be responsible for the security, not only physical, but the technical security. And that can be alleviate and change a lot of things within an organization also. But I think really where we see some of the larger and bigger impact is really on those internal workflows and the staff behavior, because we've got to be really cognizant of things like the minimum necessary standard or the least privilege. You may have heard through the NIST is basically the same thing, just everybody's got to put their personalized stamp on it. But minimum necessary is within the HIPAA law is, okay, what information does an employee actually need? Does our somebody in reception need the same access as a, somebody in HR or somebody who's a producer or an insurance agent, or, do nurses need access to all records, but do they need access, is it access at the time or just those patients for the day or that week? That might be a little bit too much, too granular, but just thinking about, okay, who really needs this kind of access and who in order to complete their job. So yeah, I would say it's probably on the staff behavior and the internal workflows, because a lot of times staff is just, it's nothing, again, not malicious. They just don't know the restrictions, and nor should they. They weren't hired as HIPAA compliance experts. They were hired to do the job that they're doing. So, and that's where we want to make sure that we're informing them as to what is proper use of this data and how it should be used within the organization.
Awesome. Yeah. I'm laughing because this is our most asked question via email. And so I was waiting for someone to bring it up is, can I get an exported version of my risk assessment report to review? And I'll take that one. I think the answer is yes. We do make you and kind of insist that you do reviews in the application to use that commenting feature, because it's only going to save us time and energy and save you time and energy if we have all of our edits, comments all in one place. Once the risk assessment report is finalized, you will be receiving a PDF version in your final document set, and the risk assessment report will be available for download in the system once that report is finalized. And we do understand there are certain circumstances. So if you email me and you let me know that it's impossible to get the 22 people that need to review the report to log into the application, we do make exceptions, but we do find that it is a little bit difficult for everybody if we get a PDF that's marked up with edits versus getting those edits in the application. And so we do kind of put our foot down in certain situations, and I apologize because I know that it's quite annoying to have to log into the application, but we are trying to make it streamlined as possible for everybody, just to also make sure that none of that information goes missing in the review process.
Yeah, thank you. All right. Any other questions here today?
I don't see any right now. I'm going to give it a couple more seconds just to see if anybody pops in with anything else. In the meantime, I will say, I know that everyone that's attending this webinar is in various stages of their HIPAA Prime subscription. They might just be in training, about to tackle the risk assessment. They might be taking the risk assessment, reviewing the report, or they've been with us for a long time. We see a couple of those names on here and doing those annual reviews. And so as we always like to say, we are the HIPAA part of your brain is what we strive to be. We are trying to take HIPAA compliance off your shoulders as much as we can. As we said, unfortunately, we can't do a lot of the implementation, but we are here to answer any questions that you have. So please ask us questions. We're never going to say no to questions. We're never going to say no. We do get policies from clients to review, especially with the SUD updates. There was a lot of pushback on business associate agreements. We are here to review those for you. If you have questions about the process, about a specific question on the risk assessment, you're having a hard time leveraging IT and getting them involved, we have worked with a lot of different organizations over our time here at Total HIPAA. And so we are always here to assist you in any way that we can. We definitely don't want you to feel like you're alone in this process. And so definitely reach out if you are feeling that way, and we can definitely help you. We understand that certain parts of this process can be a little overwhelming to start because we are asking a lot of information, and we are going to help you throughout the process, but we know that it's not an easy ask to have you sit down and complete a risk assessment. That's, has you coordinate with many departments. And so just want to leave you with that tidbit that we are here for you. And don't forget that you are paying for our services and that we love to be there for you and make you, as I said, be the HIPAA brain of your organization. Oh, we got another one. Yes, those emails, that's a great question. There are a lot of emails that come from me directly, and then there are emails that come from a project management system that we have that kind of is a gentle poking reminder, I would say, as to let you know where you are in the process. And I will definitely look at this person's account specifically, and I'll reach out to you individually to make sure that we get that resolved. But that is a great question that we do get a lot of questions about. I'm getting a lot of follow-up emails. Emails are coming from the application themselves, and then they're also getting coming from a project management system we have. And then also, if I haven't heard from you in a while, you might get a personal email from me as well. But definitely reach out to me if they are getting confusing or overwhelming in any way, and we can tailor that process for sure. They're just supposed to be gentle reminders, but I understand that it can be frustrating. So I will reach out to you directly, the client that left that comment, and make sure we get that resolved. And then we do have another question, Jason, on where should we post or maintain the NPP?
Okay. So your notice of privacy practices for our employer groups and for our medical groups, those need to be posted on your website if you have a website, and those also should be maintained within, so it needs to be given. You should have that within your office for your practice, or if you're an employer, you have a employee break room. It's a great place to post it. Also should be sent out annually to individuals, especially at times of renewal for our employer groups, or anytime you have a major change in coverage or change in services. So those needs to be sent out annually. For our medical practices, that's a good idea to just make sure as people are cycling through at their, for their annual physicals, or at any time they're coming into your office and they haven't been in, make sure that's part of your process to just make sure they're getting hands on that annually, or eyes on it annually. You just have to show it to them. You don't have to actually give a physical copy anymore. But again, another great item is, let's just go ahead and get those posted on the website. If you have an intranet for your employer, for our employer groups, go ahead and post that within the intranet also, so that employees can get at that. And then it's not a bad idea to have that on your website if you're a medical practice, depending specialty, it doesn't matter. For our insurance agents, you do need a privacy notice, not a notice of privacy practices, a little bit different. And we've given you a specific one for that. That needs to be sent out at annually, or anytime there's a change in coverage. Again, that's more from a Gramm-Leach-Bliley standpoint. So that's covering any additional products that you're selling that are considered financial products. HIPAA does not require, since you're a business associate, does not require you to produce a notice of privacy practices. That's only for the covered entities. So if that was confusing to anyone, or anybody needs me to go through anything specifically for their organization, let me know. But again, let's just remember, annual is the way to go. So I think with your privacy notice, if you're an insurance agent, you can go to 3 years, but let's just do it annually. I think I think you just put it in that process, and it's a much better way to go. All right.
And then, Jason, if they are an employer group, it needs to be sent out to employees annually and then posted on the internet. Did you say that? Sorry, I might have zoned out.
Yes.
Okay, perfect.
Yeah. And then and I see here on the company external website, I don't think you need to put it on your external website because it's for your employees. So that maybe is at the renewal time. Let's just go ahead and send it as an email. And again, it only has to go to the head of the plan. It doesn't need to go to each individual that's a subsidiary or sub of that plan. So, spouse, children don't need to get a notice of privacy practices. It just needs to go to the head of the plan.
Great. I think that's it.
All right, everybody. So as promised, we're going to be back 17 minutes. So we really appreciate everybody. Appreciate your being clients with us. And again, as Tessa said, if you have any questions, additional questions that came up, or you get something sparked at 3 o'clock in the morning and you reach out to us, send us an email. We won't answer at 3 a.m., but we will get back to you with a reasonable time frame. But again, we appreciate your business, and thank you so much from Total HIPAA. And we look forward to seeing you at our next internal webinar in 2 months. So we'll see you guys in June.
If anyone has any topics that they want us to discuss in June, we love getting topics that are, that our clients want to hear about. And so if anyone has any questions that they think would be a great internal webinar topic, please let us know.
Right. And we should be releasing, we're still working on locking down a guest for our May webinar, for our external webinar. So once we get that, we'll let you guys know. I think we're trying to get somebody really fun in. So, but yes, I love the comment, 3 a.m. hit too close to home. So, well, guys, thank you so much. Appreciate everybody. And yes, we will be sending this recording out to everybody once we get it. So you will have full access to that. So thank you, everybody. Have a wonderful day, and we'll talk to you soon.